Okay, all right guys, so what are this is gonna be combination Foley catheter care and emptying the drainage bag. So what are my first 5 steps going to be?
Knock, identify,
explain,
privacy, and hand hygiene.
Perfect. Now what can I do?
Raise your leg rails.
Yeah, raise my rails. And then where does my bed need to go? And what do I need to grab before I would put this rail down?
Your part.
Okay, so I'm gonna grab my table. I've got everything in front of me. Now I can put this rail down. What can I do next? I need to provide privacy, so I'm gonna do that with my bath blanket and drape my patient. Do I need to wear gloves for that?
No.
No. So that is fan folded down. And now that she's covered, I can go ahead and position her before I would place my waterproof pad. And remember, we're positioning the same whether it's a male or a female. Now I'm going to place my waterproof pad underneath her. So what would I need to do before I can do that?
Put your gloves on.
Now I need my gloves. And we're just tucking that pad underneath. We don't need to roll them or anything like that. Now I can go and remember we can do this part at any time. I'm going to tell my evaluator that my water is how full?
2/3.
2/3 full, and I'm going to check the temperature. Do you guys remember the temperature? 110 to 115. Yep. So remember, you can do your mitt or you can do just folded like this, whatever you guys like better. I'm going to get my washcloth wet. I'm going to add soap, and I'm going to uncover my patient. So I have a male here, so I'm going to retract the foreskin. If it were a female, then I'm going to separate the labia. So I'm going to retract the foreskin here, and I'm going to just clean around the urinary meatus. So I'm going to do 1 swipe, 2 swipes going further back, and then even further, 3 swipes, okay? So if this were the penis, we're starting here at the tip, we're doing 1 and then back, 2 and then 3, okay? So just further back every time. If it were a female, we're just doing 1 side, 2 sides, 3 sides, okay? Because this is catheter care, this is not peri care, okay? Peri care, I'm cleaning everything. Catheter care, I'm only focused on the catheter right now, so I am not including peri care in there, okay? So I am not going to wash the shaft, I'm not going to wash the scrotum, I'm not going to turn them, okay? And I don't want you doing that on testing day because you're showing your evaluator you don't know the difference between peri care and catheter care, okay? So only the 3 swipes, okay? So everything is clean. Now I've got a new washcloth with just water, and I can go ahead and rinse that. Once I've done that, I've got a new washcloth with soap, and I'm going to clean the catheter itself. This is this is the most important part of this skill. When I am cleaning the catheter, I am holding the catheter right here at the tip at the urinary meatus, okay? Because when I clean this, when I'm pulling down, I do not want to tug on this thing and cause any pain to my patient. So I'm holding it right here, and I'm just going to do 1 swipe, clean side, 2 swipes, 3 sides, okay? So I want to go 5 to 6 inches down, so pretty far down on the catheter. So now I've got a new washcloth and I'm going to rinse. Again, as I'm rinsing, I'm holding it at the urinary meatus and going down. Now I can take my towel, I'm holding the urinary meatus and I'm patting everything dry. The next thing I'm going to do, and this can be done before you start cleaning, it can be done after you clean. I don't care when you do it, but before you're done, you're going to tell your evaluator that you are checking the catheter. You're making sure that there's no kinks, okay? So I don't want my tubing kinked up. I don't want this kinked up. I don't want it to be underneath them at all. I want to make sure that this is coiled on the bed. I just want to make sure that it's able to flow freely, okay? And then I'm going to check the leg band. So I'm just going to tell my evaluator, I've checked the leg band. There's no redness. There's no irritation. Everything is flowing freely. It's coiled to the bed, okay? So everything looks good. So now my patient is completely clean. So now I can remove this check pad or waterproof pad, and this can be discarded. Once I've removed that, what else can I remove?
Your gloves.
Yep, so now I don't need gloves anymore. So I'm going to discard those. And those go in the trash. And then I can place my patient back down, and now that part is complete. So the Foley catheter care is complete. Cover them back up. This gets fan folded down. I'm gonna pull this out. Remember, when you guys are pulling this out, it's staying away from you, okay? I never want it touching your body or up close to you. And we're rolling it inside out, and then this will be discarded into the dirty linen. Okay, so this part is done. So now I can go ahead and raise my rail and lower my patient as if I were gonna be ending this skill. With this skill, there's a lot of things that can go kind of out of order, and it's perfectly fine, okay? So once I have her completely lowered, if I want to leave these rails up and do my thing and then put them down right before I'm finished, then that's fine, okay? As long as when I leave the room, they're down. But in my head, it makes more sense. Her bed's down. I'm just going to go ahead and lower these. And now I'm going to empty that drainage bag. So I'll move this if you girls want to move a little bit so that you can watch me do this, because you have to be a little bit close. Okay, so on your bedside table, you're going to have a chuck and an alcohol pad, okay? So for me to do this, I need to put gloves on. So what would I need to do before I would put on gloves?
Wash your hands.
Yep, I'm never putting clean gloves on dirty hands. So my hands are clean. And remember, you may have sanitizer sitting on your table the day of testing. You can grab that and pretend, or you can just verbalize that you've washed your hands. Either is fine. Okay, so I'm gonna take my check pad and lay it down here. And then I've got my alcohol pad. So this is just a privacy cover. We leave these on catheters, so if our patients are out and about moving, you know, everyone doesn't see their urine. This will be on your bedside table too. It won't be hidden. So I'm gonna lift this up. This will be pulled out. And to empty this, I'm gonna push this blue part over, okay? On the day of testing, this is not full. It's all just pretend, okay? So I'm going to let this drain. When I'm doing that, I don't want the tip of this touching this graduate at all, okay? It should be in the middle. It should never be touching anything, and I shouldn't be touching it with my fingers. Once it's drained, I'm gonna press this back with my alcohol pad. I'm gonna clean that, and that goes back in here. And then using my check pad, I will pick this up and set it here on the table. to measure this, I'm gonna duck down because we never measure we always wanna be at eye level to measure, okay? So I'm gonna duck down and my evaluator is gonna tell me one of these colors. Whatever color she tells me, that's where I need to read it at, okay? We're always reading it on the cc side. So cc or milliliters, same thing. So I'll read it right here on the orange, and that's gonna be 350 cc's, okay? Once I've done that, then I'm just going to verbalize to my evaluator that I would empty and clean my cylinder. Then this can be thrown away, discarded. My gloves can come off after everything is clean. And now I can do my last 3 steps, which are, she's got her call light, wash my hands, report and record.